My name is Marissa Lena Rivera, and I will be performing the long bone compression test. So what I'll be assessing for is a possible fracture in the first metatarsal. So what I'll first do is put one hand at the base of the head of the first metatarsal and one at the base of the first metatarsal, and I'll apply an axial compression.
Ow.
Okay, so he had pain in the possible fracture site, so that would indicate a positive test. Performing the percussion test, also known as the bump tap test. The pathology we'll be assessing for is a tibial stress fracture. So the first step I'll take is to put my one hand over the metatarsal region and put his foot into neutral position. And then I'll take the heel of my other hand and tap his calcaneus. And then it's important to not tap the suspected fracture site. The positive test would be indicated if he feels pain in the suspected fracture site on the tibia. So I'll be performing the anterior drawer test now. So what I'll be assessing for is injury to the ATF ligament and the CF ligament. So what I'm going to first do is put one hand on the back of his heel and have his foot relaxed but in dorsiflexion on my forearm, and then put my other hand on his tibia for stability. And then the action I'm gonna do is pull the heel forward. And I'm checking for laxity. Laxity and pain would be a sign of a positive test, but this test has to be done bilaterally so we can compare the laxity between the two ankles. And that's the anterior drawer test. Okay, so now we will be performing the Kliger test. For this one, we'll be assessing for injury to the CF ligament and the deltoid ligament. So I'm first going to do is have one hand on his tibia and the other hand over his metatarsal region. And I'll be moving his foot laterally to be checking for laxity, which is a sign of a positive test, would be laxity. And then this test is also done bilaterally. And yeah, again, laxity would be the sign of a positive test. Okay, so next we'll be performing the Ottawa ankle rolls. So basically what we're assessing for is a possible fracture in the malleolar region. So I'm going to start with palpating the distal 6 centimeters of his foot right below the malleolus. And then if there's point tenderness in the palpation, or if he walks 4 steps and feels point tenderness in that area, then it is a positive test for a possible fracture. So I'll be performing the squeeze test. What I'll be assessing for is integrity of the anterior tibiofibular ligament. So I'm going to start off doing is placing one hand on either side of his leg, distal from the syndesmosis. I'm just going to press together, causing separation in the syndesmosis. Pain in the syndesmosis would indicate a positive test. I'll be performing the Maddles test. So what I'll be assessing for is a rupture in the Achilles tendon. So I'm going to first start off doing is having him bend up both knees. And then what I'm observing for in this test is dorsiflexion, or anything that is not in a neutral position, so even like a dangling foot. So right here is, if he was like dorsiflecting like that, that would be an indication of a positive test in an Achilles rupture.
Hello, my name is Eric Pena, and I'll be performing a vibration test. So we're suspecting a fracture in the middle region of the tibia. So to perform this test, we would take a tuning fork, we would strike it, and then place it a distance away from the suspected fracture site. So in this case, we want to put it on the medial malleolus of the tibia. So once placing it here, we will then look for the person injured to respond in pain. And this is a positive test for a fracture at the suspected site. Tonight we'll be performing a POTS compression test, and we are assessing a fracture along a long bone. So for example, if we're suspecting to be a fracture along the medial malleolus of the tibia, we then begin our test by pressing along the medial aspect of the tibia, and with the right hand the lateral aspect of the fibula. And we begin compressing and slowly working our way down. A positive for this test would be them experiencing pain along the distal portion of the tibia. Alright, we'll be performing a dorsiflexion maneuver test, and we're assessing a suspected injury to the tib fib and the syndesmosis. So to perform this test, we would want to have our patient relaxed. We'll place one hand along their leg, and the other hand will begin passively dorsiflexing the foot. And then a positive sign for this would be them experiencing pain along the syndesmosis. Alright, we'll be performing a lateral tilt test. And to perform this test, you need to place one hand along the lateral portion of the leg, close to the lateral malleolus, and then the other hand on the medial portion of the calcaneus. We will move the foot into a neutral position, and then we'll begin adducting and everting the foot. We are assessing the integrity of the deltoid and the CF ligaments. A positive test for this would be them experiencing both pain and laxity to the deltoid and the CF ligaments. And because we're testing laxity, we would need to test this bilaterally. Alright, we'll be going over the Ottawa foot rules. So when we suspect a fracture in the midfoot, we would test through point tenderness. So they'd be experiencing pain if we palpate anywhere between the midfoot region. And then we'd also have them walk for 4 steps. If they are unable to weight bear, that is a positive test for a fracture at the midfoot. Alright, we'll be performing a Thompson test. To perform this test, we would need to have our patient lying prone on the table, and we'll need to place our hand over both the gastroc and the soleus muscles. And we're assessing the integrity of the Achilles tendon. So we would then squeeze firmly. And a positive test for this would be that no foot movement or ankle movement towards plantar flexion.